one of the important things about digestion is that our cells, our organs, our tissues need nutrition or nutrients. And remember, again, we're talking about a combination of things, nutrients and energy together, which make up our biomolecules. And then those things are absorbed into your blood. The point of having nutrition, nutrients, and energy is to fuel your cells so that they can undergo the process of cellular respiration. Next chapter, we'll talk about the relationship between digestion and respiration and getting those things into your blood to carry around the body so that your cells can be fed to metabolize, work, and make your tissues and organs function appropriately. The biomolecules, the fats, carbohydrates, and proteins, these are all the basic biomolecules, are building blocks for the bigger things in your body. Other things that you need from your food sources, are minerals and vitamins. Those things are what we often call coenzymes. They help your enzymes. Your enzymes facilitate the efficient working of your metabolic processes. So we need those. So let me ask, anybody here believe that you get a perfectly balanced diet every day? Every week? Maybe in a week? I see a lot of maybe, yeah. So some yeses and some nos. It's hard. It's especially I know how busy you all are. It's hard to plan and think about, well, I'm gonna get all of the nutrients I need. And that's when we're looking at a well-balanced diet, we typically think about like maybe day to day, but it's really kind of like over the course of a week, are you getting everything that your body and your cells need? And oftentimes, even within a week, we don't. We're not eating good enough. We're not planning enough because we just don't have time, and it's stressful to add that on top of everything else that's going on in life. So one of the things that can help you in just a real basic, simple thing is take a multivitamin every day, especially this time of year as you're getting closer toward the end of the semester and the pressure's on. You might not get even as close to a balanced diet as you did a month ago. And then it's cold and flu season, and that will help you and your immune system to kind of give that a little boost. So if you don't do that, multivitamin, you can get a huge bottle for $10-15. Not a bad idea. So let's talk about your metabolic energy in terms of hourly. Per hour, you typically burn about 70 calories at rest. So meaning that if you think you're just sitting down and you're doing nothing, are you doing nothing? No, good. So you're breathing, right? At least we know that we continue to breathe. Our blood continues to pump. Our cells continue to process nutrients and energy. We continue to take waste products out of our cells. There's so many things that are happening. All of the things that we've talked about thus far in the other systems, they're happening. And we don't even realize maybe when we're doing quote unquote nothing. So if you're doing what you think of as nothing, you are still burning approximately 70 calories per hour. So that's kind of a good thing, right? In terms of your calorie burn. This can vary greatly depending on if you're 5 foot tall or you're 6 foot tall. That can be a big difference. It can depend on your muscle mass. If you're somebody who works out a lot as opposed to somebody who doesn't. Not only do you burn calories in working out, but also when you work out, you build more muscle, and muscles, they need more energy per glucose. So they make more energy, I should say, per glucose. So you actually end up burning a little bit more. It's a more efficient process. Your age, about somewhere in your 20s, your metabolism starts to go down a little bit, so that resting rate starts to decline. Some of you might have the genetics where your resting rate just stays maybe almost about the same your whole lives. But in general, most people's it starts to tick down. And for some people in their 20s, it significantly goes down. Just depends on your genetics. your sex. Males have more muscle in their body, so they burn a higher resting rate than females. And again, that also is influenced by how much you work out, your genetics, a lot of other factors as well. So it's a combination of these things, what your calories per hour at rest are burned. If you exercise, you certainly can boost that by burning some during exercise, and like I said, by building muscle. If whatever your resting rate is throughout the entire day, in addition to what you burn by, doing things like just sitting here and taking notes, you're burning a little bit extra calories because you're moving. Also, if you exercise during the day, whatever your resting rate plus all of the extra things that you do in a day, you add those together. If you consume more calories than that in a given day, then you will store that extra energy, nutrients in your body. Over the course of a day, a week, a month, if that extra adds up to about 3,600 calories, you can, again, a lot of it just depends on genetics and things like that, but approximately 3,600 extra calories in your life over the course of a day, a month, a year, equals to the gaining of 1 pound of fat, approximately. So let's talk about causes of obesity. This is an epidemic greatly seen in the United States, but worldwide. There's a lot of things that influence obesity. We know now that there are genes that make some people obese as opposed to other people who are not. And we're not sure why. There's a lot of science still to be figured out by that. So that means that some people will struggle with gaining weight over their life as opposed to some people, like I have a friend who she struggles to put weight on. So I, for example, if I have a certain amount of calories, that's a pretty low amount, then I can lose weight. But if I eat, like my husband, he eats probably 3 to 4 times, or maybe even 5 times what I eat in a day, and he never gains weight. And I'm always like, it's very apparent to me when we spend an entire day together, because he'll eat breakfast, and then he'll have breakfast 2, and then he'll have a snack, and then he'll have lunch 1, and lunch 2, and then a snack, and dinner 1, dinner 2, and a snack. And I'm not even exaggerating. And when I say like meals, he eats like a meal. My meals are usually pretty small. I usually have like 1 big meal a day, and then I have a lot of like healthy snacks throughout the day. And so I might eat the equivalent of 1 of his total meals in a day, and he's eaten about 6 meals and at least 3 snacks per day. And he never gains any weight. So it's just kind of, we look at each other like, oh my gosh, right? A big difference. So that's the way the cookie crumbles, so they say. There's a lot of other influences in your environment of weight. And so one is, you can drive up and get your food. You don't even have to get out of your car and spend the energy of walking up to get your food. Food is manufactured now to chemically taste delicious. So here's like a really interesting thing. One of the modern methods of making food and manufacturing food is that you can, instead of just putting like ingredients to make it taste good, you can put chemicals in there that take the place of ingredients. And so you could have pretty poor ingredients and add some of these chemical factors to make it taste delicious. And you're like, oh, this is yummy. Some of these chemical factors also can be somewhat addicting in a lot of different ways. So one of the ways that food can be addicting is that if you have a very pleasant memory of ice cream when you were little, because it made you happy to go with your family or go with a special aunt to get ice cream, you might, when you want to be happy, you might think, I'm gonna have ice cream. That's gonna make me happy. And it does, because that memory of ice cream, when you start eating it, it brings back those happy memories. And so for a lot of us, the smell of food, the taste of food, the idea of food can bring back good emotions. So it's kind of interesting too, in terms of this like idea of our food being delicious has so much more than just taste associated with it. We also can get really cheap food quickly, easily. And so if you have high calorie foods that are really, really cheap, and I know a lot of you are on budgets, that you might decide, you know, that box of Little Debbie's is 99 cents, and I've got a whole box of these snacks, as opposed to a pound of grapes, which might cost $5. You might weigh out like, well, I can get a lot more calories a lot cheaper, even though this thing that's cheaper is not as healthy. And so a lot of us, especially when we're looking at people who are at lower socioeconomic levels in our country, is that you have to make choices. Even though you want to eat healthy, you just can't financially. And so there's a lot of conundrums in terms of how we consume our food and what that does to the health of our bodies. Also, one of the pleasures that we have in life is to sit and do all kinds of crazy things on our phones, right? On your computers, on your tablets. And so we don't have to move around much to have entertainment. And so a lot of us are more sedentary. So we're not burning those extra calories above our resting burn rate. So let's talk a little bit about BMI. This is a strange way to calculate whether someone is healthy or unhealthy, because there are a lot of factors for many people that you don't fit into the box of the BMI, the body mass index. So for example, if you look at two people who weigh, let's say 200 pounds, one person who weighs 200 pounds might look very slim because they work out a lot. And the next person could be shorter and have a very sedentary lifestyle, make choices based on their financial situation to not eat as healthy, and so they have a lot more fat on them. So these two people, because they weigh a certain amount, and even let's say they're the same height, one person might look like they weigh more when they don't. Those two people fit into the same BMI level. And there's certainly a difference from someone who works out regularly and someone who doesn't. And so the BMI, I always like to say, you know, take this with a grain of salt. I think that we can kind of tell, if you're honest about how much you're working out and what kind of foods you're consuming, and know a little bit about your genetic history. Maybe some of you do and some of you don't. But at least if you know like how much you're working out, you're exercising, your circulatory system, your lungs, the rest of your body, your muscles, and what you're consuming, you kind of know how healthy you are, right? So again, let's take this all with a little bit of a grain of salt, because not everybody fits well into the BMI calculation. So BMI is between, what they say is between 18.5 and 24.9 are considered healthy. So you could be 24.9 and be healthy, and then you could be 30 and be unhealthy, right? So again, the Center for Disease Control estimates about 33%, a third of the population of adults are overweight, and 33% are obese. So we're talking about maybe, again, a lot of variance, maybe half of our population is overweight or obese. Probably it's a little bit lower than the 66%. So the typical way that BMI is calculated is that you take your weight in kilograms. A kilogram is 2.2 pounds. You divide it by height in meters. It's about 3.3 feet. And you divide that again by your height in meters. So for US, because we don't use, unfortunately, the metric system, which is so much easier to utilize, I believe, than pounds and inches and feet, etc., is that you take your weight in pounds, you divide it by your height in inches squared, so it's a little bit different, and you multiply that by a conversion factor of 703 divided by your height in inches times 703. It's a lot more complicated. So let's say that someone weighs 150 pounds. and they're 5'5" or 65 inches. Their BMI calculation is 150 divided by 65 squared times 703, and they come out to 24.96. So again, if you're looking at where they're at, a person who's 150 pounds is right close to being unhealthy. So you think like, wow, that doesn't seem like a lot. Again, lots of factors that go into it. So let's talk about the health effects of obesity. We've heard a lot with COVID that people who are obese or overweight, they are more affected by COVID, by the illness. People who have type 2 diabetes usually is a genetic factor that also goes with being overweight, not always, but most of the time. Heart disease, usually people who are obese are not eating their best, but again, not always. We have a lot of factors here. Strokes goes along with having heart disease, high blood pressure, hypertension, again, circulatory system issue, high cholesterol, gout, which can be a breakdown of your tissues, mostly in your extremities, sleep apnea, that you actually stop breathing while you're sleeping, osteoarthritis, a lot more pressure from weight on your joints, gallbladder disorders, you're eating a high level of fat often, again, not always, fatty liver disease, again, you're saying fatty, right? You're consuming higher amounts of fat. GERD, where you're having issues with your esophagus, that you're eating too much, that your stomach is producing too much acid, and then thus you might be burping, and then that acid is going up your esophagus and causing a little bit of issues there. Certain kinds of cancer, and then we'll talk a little bit more about the psychological and emotional effects of obesity, which are super, super, super common, especially things in our society where an idea of beauty is very skewed. So what are some of the things that can help someone who's overweight or obese is they say just losing 10 pounds can make a huge difference in all of those factors. And so I think it's a good thing to say, like, start there. Start with a small goal, right? Lose 10 pounds. Once you get there, reevaluate, move on. See how you feel. Oftentimes, if people lose 10 pounds, you feel a little better. That your body, maybe your joints, you feel lighter, right? So there can be just very, very easy, simple benefits to just doing a little bit. About 2/3 of Americans are overweight or obese. We already talked about that. So let's talk about our society. And this is not just the United States, this is worldwide. We have a very messed up, racist, skewed idea of what beauty is. And so eating disorders are not always just in women. I mean, not always just in women, but also men can suffer from eating disorders. It's about 10% of men. It might be higher than what we know. Eating disorders, often there is a factor of severe starvation. So we have all this food available to us, and people are psychologically thinking like, I'm better off to starve myself than I am to eat healthy. Sometimes to the point of death. Starvation over time can cause a lot of stress on your heart and actually can cause heart failure, can cause heart attacks. You can see somebody who's very, very thin and they have a heart attack. It's too much pressure. So let's talk a little bit about anorexia. Anorexia is the intense fear of gaining weight. Some people are so thin. Like the woman in this picture, she believed she was fat. She just saw herself. She looked in the mirror. She thought, I'm not beautiful. I'm not healthy. I'm too fat. So people with anorexia will eat very, very little food. Like every day might consume 100 calories and think, oh, I gotta get that down. Often, not always, but often, they will exercise compulsively. If they eat an apple, they'll think, I have to work out for 2 hours to work off that apple. They not only will burn off all of their body fat, but muscle, and also will start to, once your body, if you don't have much muscle on your body, in terms of like your muscle on your bones, your body will start to take from muscles around your body. For example, your circulatory system, if you remember the blood vessels, they have layers of muscle. They'll start to take from there. It will start to take from the muscles that line your digestive system. Almost every organ in your body is helped by muscle. So your body will start to take that. Your body will start to take away from your organs. So that's why, like marathons. When people are running marathons, when you get to about mile 20, your body is so overtaxed that even though you might have stores of fat, your body is so confused as to what the heck is going on that your body will literally start to eat important parts of itself. So I was always a runner my whole life until I had some accidents and knee issues and hip issues, but I would never run more than 6 miles. I just wasn't, long distance running wasn't for me. So I would just always look at people like, all these people running marathons and think, wow, why are you doing this to yourself? But there's a goal, right? There's this, again, it's like a society thing that we should run these huge long things. And people think, I'm so healthy, I'm running a marathon. And then after 20 miles, your body, you're doing really bad things to your body. So anyway, there's all kinds of psychological things going on in our society. This disease, it pretty much disrupts all of the systems of your body. So we talked about heart, reproductive and endocrine go similarly together. Endocrine system, not just, we're gonna focus on the endocrine in regard to what it does for our reproductive system in the next unit, but it really has it's a chemical messenger system. It affects everything in your body. And reproductively, oftentimes what you see that people who have an eating disorder, they have issues with fertility. Okay, so this woman is Isabelle Carro. She died at the age of 28. She was 5'4", and at the end of her life, she weighed 55 pounds. She did these ads. She was a model, and she did these ads in France. She was French, to show people. She actually started to recover, and a lot of times with people with eating disorders is that there's a long road to recovery, and there's usually lapses in it. It's very similar in nature to people who have addictions, is that you might be doing well for a while, and then there's a trigger, and then you backslide, and then you work hard. And so she had been recovered and then kind of had one of those backslides and ended up passing away. But in recovery, she wanted to tell people, especially young people, this is what the disease of anorexia looks like. And even though these are rather shocking, she was like, I want to shock people into education. And so this was very, I think, brave of her to put out this campaign. So let's talk about another eating disorder that has a lot of overlap of anorexia, bulimia. People who are bulimic and anorexia, they might suffer from both because, again, there might be periods where they have both behaviors. And usually people who are bulimic, again, usually are normal weight or overweight. So you might look at them and think, oh, they're fine. But they engage in what's called binge eating, where they will eat a large quantity of calories quickly. And then they think, oh my gosh, what did I do? And they end up doing a purge. And that purge can be vomiting, and it could be with laxatives. They want to get those calories out of their body as quick as possible. Often associated with bulimia is also compulsive exercise, but again, not always. So issues that people who have bulimia, who vomit often, and again, this might be found in someone who's anorexic, might have some of these symptoms as well, is that dentists can tell usually if someone either has like a digestive disorder where they're like GERD, where they're burping up acid, or if there's somebody who's vomiting a lot, because the acid can start to break down the enamel on someone's teeth. And so if someone has a lot of cavities, the dentist might be able to see, well, what's causing it? Is the enamel thinning? And then the dentist might be the first person outside of that patient's circle to say something more is going on here. Again, throat, gums, lots of damage to the digestive system up in the mouth area. Can cause in the digestive system, because the digestive system, we have that regular, when you eat, you have acid that's made, and then we talked about how the pancreas is going to neutralize that with bicarbonate, but if it's coming up, oftentimes they're eating and then they're puking right like before the bicarbonate can be released, and so that is very acidic. The digestive system has a lot of factors in that there's a lot of muscle layers so that the acid doesn't go through your digestive tissues into other systems of your body. There's also mucus layers that are going to protect the lining of the muscle as well. And so if you continuously are subjecting your digestive system to these acids, to the acid, is it can start to break down and actually start to cause holes or ulcers in the digestive system, which are very painful. The esophagus, it can cause the esophagus to rupture, and that is extremely dangerous. That could actually kill someone. Over time, it can also cause the stomach to rupture. And why that's dangerous, again, is if you have acid and enzymes that break down carbohydrates, proteins, lipids, especially protein digestion begins in the stomach, then you can digest other proteins in your body, right? So that's where it becomes dangerous, that you can digest important things. So let's talk about causes of eating disorders. It's super duper duper complex to diagnose. Why? It's very poorly understood, but there are definitely genetic factors. If someone's mom had an eating disorder, they've got to be real careful. If you have a relative who has an eating disorder, you are 5 times more likely to also have an eating disorder. A lot of that too is psychological, because you're seeing this person and how your parents model healthy eating is what you often think of as healthy eating, right? Just like I said before, that maybe you have a special aunt who always brought you for ice cream, that might bring you joy to have ice cream because you think, oh, brings back all these happy memories. Well, if you see your parent eating like an anorexic or bulimic, then you're going to think that's the way I should be doing things. And so psychologically, that just becomes part of your nature. Often linked with an eating disorder is anxiety and depression. There are certain personality traits that are associated with people with eating disorders, as they have low self-esteem. They are always trying to reach perfection, which nobody's perfect. And they always want acceptance. They want to achieve things. They might be an overachiever, working super hard to look like the perfect person with the perfect life, with the perfect GPA, with the perfect everything. So they put a lot of pressure on themselves. A lot of this is caused by our society. And like I said, we have a very skewed idea of beauty and health in our society. Often these traits begin in adolescence. So when someone is young, and this is very dangerous because the body is quickly developing. And so you can have a big impact on doing things that are unhealthy when you're young, like formation of your muscles, your bones, your endocrine system. And all of these things have a huge factor on your health in your future. Social media. You've heard probably in the last few weeks a lot about the influence of social media on adolescents, and especially teenagers, is that there's a lot of laws going out there, there's a lot of talk of the social media companies trying to revamp the way they do things, because a lot of kids will see this and they'll go, oh my gosh, look at all these people who are so beautiful. Well, they all have filters, right? And so there's a big issue with that. Everything you're looking at that's beautiful, and somebody's sitting there with Photoshop and taking out every single flaw, you don't see all that. We don't know all that. So we start looking at these things. If you see images all the time, and it's a white woman with blonde hair and blue eyes who's beautiful, then you're gonna be like, well, that's not me. I don't look like that. And then you're gonna feel badly about yourself. And so there's a lot of subtle sub-psyche things that happen in what you see regularly in social media that you don't even know are having a negative effect on you. And we're seeing a lot more and a lot more of more diversity in what beauty is. The body positive campaigns are great because it's really like, beauty, should it be superficial or should it be how we treat each other? So there's a lot of things that are messed up out there. There's also a huge message that says the skinnier you are, the more beautiful you are. So if you go to the Art Institute and you look at paintings from 200 years ago, the people in the paintings are all voluptuous. They're very big. That was beautiful because people who had money could afford to eat a lot. And so if you were a bigger person, and people would actually strive to gain weight to show, I can gain a lot of weight because I have a lot of access to money. Okay, well, there's a messed up factor there too, right? Because now, back then, while it might be like, well, bigger was beautiful then, but also richer was beautiful. So even in cases where it's like there's certain characteristics that are beautiful, and you also see that most of those people are white as well, that there's a lot of messages that when you start to dig a little deeper, you're like, oh, that's kind of messed up, right? So it's always been messed up. So why can't it just be beauty based on personality traits? So a lot of things that are acceptance, a certain way you look, and then money. Who's on social media? Everybody's rich, right? Who's seen a lot. They're making a lot of money. So also it gives you that subliminal message that if you are not rich, you don't mean anything in our society. If you don't look a certain way, you don't mean anything in our society. And so there's a lot of very unfortunate messages. And again, you could see that over time. So the treatment for an eating disorder, it's very complex and difficult. So there's nutrition therapy for malnutrition. Nutrition therapy to say, this is what a balanced diet looks like. This is what your daily intake of calories should be. This is the amount of calories you can eat without gaining weight and maintain a healthy weight. This is what a healthy weight for your size, your genetics, your height looks like. And so there's a lot to be explored there, which means that not only is there someone who is a nutrition professional working with a person with an eating disorder, but there's also someone who works in psychotherapy, trying to get at what is the trigger that you see in the world that makes you go toward these behaviors. Antidepressants are very useful. Antidepressants, anti-anxiety drugs can help greatly regulate some of that endocrine system, but working with all of these professionals is expensive. And another unfortunate factor in our society is that healthcare is expensive and it's complicated. And so let's say that someone has even decent health care, they might be able to get covered. Let's say the psychologist, they might be able to get covered, but they might not be able to get the nutritional therapist covered. So a lot of times it just is not fair and it doesn't work. And that's really unfortunate. A lot of times what will happen is that because, let's say that they can't afford it, they're going to hide their symptoms even from their professionals that they see. Because now you've got this other layer of pressure on you that if you know, let's say that you're a teenager and your parents are having issues with money and you know they're struggling because the nutritionist is not paid for, that they have to pay for out of pocket, you might start to act like you're totally fine because you're worried about your parents' financial situation. And so again, it adds layer upon layer of these psychological pressures on someone. Fewer than 50% of people recover, and then often there's lapses as well. It's very, very hard. So let's talk about some other things that we see in the digestive world. There are weight loss surgeries that are out there. So again, if someone is overweight, it doesn't mean that they are lazy. It doesn't mean that they're not trying to lose weight. It could be a lot of factors. It could be financial. It could be genetic. Like I said, between me and my husband, there are clearly different genetic factors there. I have always been extremely active. I played basketball all the way through college. I ran 6 miles a day since I was a teenager, and I was always overweight. And I am a vegetarian, I've been for a really long time. I've always been very focused on eating healthy. A lot of people will say, wow, you eat so healthy. And it's almost like a criticism to me. Oh, you eat so healthy. Because I know what they're thinking is, how can you be so fat? And I just laugh and I say, yeah, I got it. I'm the healthiest fat person you'll ever meet. That's the way it is. And so I know, for me, I know that my goal is to keep my heart healthy and eat healthy. And so beyond that, I do my best. So for some people who maybe there are things in their life that got them to be so heavy that their knees are just so overburdened by their weight, but they're trying so hard to lose weight and it's just not significant enough. There are weight loss surgeries that a doctor can recommend to help them. And so if they go through a period where they're like, okay, I cut my calories, I increase my activity, weight loss is not happening or it's just so slow, they might have this recommendation. So maybe the next time you look out into the world, it will be easier to not judge. These surgical fixes will reduce the size of the digestive system so that not as much nutrients and energy are consumed. These are surgeries. They are major surgeries. You are reducing the size of a really important organ in your body, the stomach. And so that can be very risky as to the outcomes of it. Oftentimes too, there's a lot of factors with someone who's overweight, is that if they were, let's say, they had some trauma in their early life and that ice cream from that aunt is a factor that helps them to feel better about the world. Well, what if they have the surgery but they still want those good feelings? They have to realize I can have a scoop of ice cream instead of maybe 2 scoops, or I can have a spoonful. And so there's like a little bit of things that they have to adjust. And sometimes that's very hard for people. So gastric bypass is one solution. Half of the weight loss surgeries in the US are this. And what they do is they just cut out part of the stomach. So the stomach becomes very small. So you can see it's called bypass because they're going to basically connect these together. So a little bit of the stomach is connected right to the small intestine, right here. So they're going to take the small intestine from down here and they're going to bring it up to just a little bit of the stomach. So they're going to bypass all of this part of the stomach and the rest of the digestive system. So a person who has gastric bypass can only eat very small amounts of food. So again, if you remember from last time, I talked about the stomach is approximately about 3 of the sizes of your fists. It can stretch quite a bit more. And so maybe someone who gets bypass, we're talking about like a half of the size of their fist as opposed to 3. So a piece of pizza, if somebody eats 1 piece of pizza, they may only be able to eat like a little tiny bit, like a third of a piece of pizza, and then they'll have that full feeling. But psychologically, they might be thinking, wait, I usually eat 2 slices of pizza, and that's satisfying to them, but they've got to get used to the fact that this much has to be satisfying now because their stomach is much smaller. So those things can be very, very impactful. The other thing is that they are consuming not only less calories, but less nutrients. And so what they consume to fill them up has to be super, super planned out. Which means that that's a huge layer of stress in your life, right? If you're trying to, from your food, get all these healthy nutrients, you've got to plan. We already talked about that. It's so hard to plan. So they have to be really, really careful. Oftentimes they also will have to take a lot of supplements because there's reduction in certain kinds of minerals and vitamins like calcium, iron, D, B12. They're going to have to supplement with that or be sure they are getting that through their food every day. So it's very complicated. It can be extremely effective if the person can change their behaviors and plan everything out well. Yeah.
Some people I know who did the surgery, they lost weight for just a short period of time, then they gained the double weight they were.
Yeah.
Why is that?
Yeah, because they just can't stick with the behavior plan. Again, remember, like if one of the things that, one of the many factors, certainly I would say everybody who's obese, there is a genetic factor. But there's also, again, every one of us has some kind of food that's a trigger for happiness. If they're feeling so stressed out about losing weight, then they might start to slowly go back to that trigger for happiness. Plus the genetic factor is still there. It's just a huge behavioral thing. There's also a psychological thing that as a person loses weight, they may get a lot of attention in a positive way that they've never gotten before. And that might be like really a negative thing for them. And to think like, well, why am I so cool now? Why am I so beautiful now? Why wasn't I beautiful before? And that can be very damaging to a person. There's so many factors as to why a person might go back. Could be, part of it could be financial, and that maybe they can't afford the nutritionist anymore. And so they don't have that regular check-in with someone to make sure that they're following the plan. So there's so many reasons why. It's very complex, yes. So another way that's a little bit less permanent than gastric bypass is the gastric band. And this is a band, this is the second most common, and it's a band that can tighten around the beginning of the stomach and allow less food into the stomach without bypassing the rest of the stomach. So that as somebody loses weight and changes their behaviors, they can allow more and more food in. And again, hopefully, changing your behaviors when you open up the stomach fully, that you can maintain a healthy weight, but everything we just talked about too. So good things about it are they've found less complications with this. The results will be far less dramatic, so they can kind of like start to shrink, so to say, the stomach, or the amount of food, I should really say, the amount of food over time. So behavior can be made slowly over time, as opposed to somebody who all of a sudden you've got, this tiny little stomach and you have to eat far, far less. That can be very difficult too. Whereas this, you can start like full stomach can be full, and then you can shrink it a little bit, and so less and less and less over time. So the behavior can be changed not as quickly. Also, because you have the whole stomach still, you can absorb more vitamins, nutrients, minerals into the stomach. So it can be healthier in that way too. So maybe the planning doesn't have to be as much.